The key activities really are all around education. You've heard before about the lower middle income countries, and we're trying to educate outside of the theoretically wealthy European countries and taking our knowledge elsewhere. So we've recently been to Myanmar, we've been to Bombay. So there's a variety of lower and middle income countries that we're trying to take good nursing practice to educate them about transplant and the whole transplant process, all the way from working the donor up through to late effects and complications. So this is it's a massive project. Alexandra Babic is the lead for the Global Education Network Committee, and we're currently looking at where we're going to go next. And it might be that we go back to India. It's such a massive country, you can't possibly educate everybody in India in 3 days. So we think we'll probably have to go back at some point and go to different areas, different hospitals, and improve the knowledge base there. I suppose leading on from that is the way that this conference itself has been organised. So we have a theme each year for the conference, and this year is from junior to expert. We had a single study day on the Sunday, which is always slightly different in that we try and do a study day in a box essentially, where the talks that are presented there could be repeated at your own hospital. With the same titles, you would just need to find somebody who could fill those spaces in. And we had 3 sessions in the morning that were aimed at the junior nurse, 3 sessions in the afternoon that were aimed at an intermediate nurse who'd been qualified for maybe 2 or 3 years, and the sessions in the afternoon were aimed at somebody that had been qualified for 5 years or more. And you were bringing the nurse through a journey and hoping to educate them about basic things like nutrition, or how to care for your patient, doing basic observations, through to complicated procedures like looking after somebody with terrible graft versus host disease and the complexities based around that. So this journey throughout the day was on the Sunday, and we've carried that theme through for the rest of the week. So the Monday, Tuesday, Wednesday, we're hoping that the sessions are a mixture of very, very basic education up to advanced. So we each year have basic blood tests. So looking at a full blood count and understanding what the blood test means. Because often you look at maybe 2 or 3 parameters, but you don't appreciate what the rest of the blood parameters are. And you're thinking, why do they ask me? What's important about a hematocrit? Why do I care? And hopefully these sessions will give you that basic underpinning knowledge of what to do, all the way up to advanced procedures like graft versus host disease and caring for somebody who's got life-limiting problems due to their GVH. So this is this theme for this year, and we will decide after this conference if we have been successful in that from the feedback that we receive from people. So we're always looking for feedback to give us ideas for next year, how we can move the agenda forward and continue to educate our nurses.